For today's discussion, I'll be talking about the core value integrity. Integrity is the foundation of nursing, and it really guides how we care for our patients, communicate, and uphold our professional standards while we practice. Integrity means always being honest, even when no one is watching. Always remaining trustworthy, consistent, and really just having stability while you're at work. It also reminds us to always keep our moral and ethical principles the same. Integrity can also relate to being accountable for all of your nursing tasks, taking care of your patients, such as advocating for pain meds and actually giving the pain meds, or remembering that warm blanket that they ask for as soon as they step into the door before you even ask any questions. I think integrity is a major part on nursing and impact because it really lays the groundwork of the type of nurse that you're going to be. This is how we build trust with our patients and their families that are at their bedside. Nurses always have to continue to act with integrity and communicate honestly and be respectful of patients for their wishes and confidentiality, and be the first to admit that you've made a mistake, whether it's a small or a large one. It's definitely not always easy to say, hey, I messed something up, but I think that really is it's a core value that you need to remember to always do throughout your career. To me, integrity just means always doing the right thing, even when it's hard. For example, just today, I had a patient that was actively dying. The family would not withdraw care. She was on BiPAP. The only thing that they had specified to us is that the previous week they had made her the previous month they had made her a full code after being a DNR and ENI. So they were on the fence of continuing her care, keeping her a full code, and today specified that they wanted no intubation. Well, the patient needed intubated, or her CO2 was just going to continue to rise. So the hospitalist came in and was just saying, they really kind of persuading them to withdraw care because the patient was starting to model, not doing well, the CO2. She had severe history of COPD, and I feel like this is hard. So it's kind of tests your integrity of what should I do here? How should I persuade the family, or not necessarily persuade, but educate the family into knowing that this really isn't the right thing. But of course, the family at this point in time wanted to continue care, so I did all of the things, and I respected that, and I gave all the medications, did as I was supposed to do, and really just kind of supported them through the entire thing, even though that maybe their decision wasn't the best thing for the patient. I supported them through that. And I think that just kind of shows, as a nurse, you have a expectation and a standard that you want to uphold, and you want to do that for all of your patients, regardless of the choices that they're making or how they are carrying out their wishes. As a nurse, I believe integrity is really, it just transforms the skill set into compassion and trustworthy care, and it's how we show respect to our patients and ourselves while we're practicing. Thanks.